Hey, hello everyone, and welcome to yet another To Talk with Your Dentist on the dentistry.com. I'm Dr. Rekha, and the To Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentistry.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the To Talk, I have Dr. Niketh. To give you a brief introduction about Dr. Niketh started his journey as a dental professional in the year 2001 and took to dental consultancy as a profession in the year 2015. He's a co-founder and a mentor at Dentman Practice Management Services. He has shared his views about dental management practices at various platforms of the IDA, including many state conferences. His consultancy, Dentman Consultancy, is a very new forum in India's dental world and is probably the most important aspect of dentistry today. Apart from consultancy for dental clinics, Dr. Niketh delivers other programs including basics of buying and selling, courses for beginners and advanced training for development of systems in dental clinic, team building programs, and various skills to help dentists establish their practice. He's a pioneer in providing the consultancy to dentists and their teams to communicate with their patients, which results in a world-class patient journey, more patients saying yes to treatment plans, and increased profits for practices. Currently, Dr. Niketh and his team are working on the practical implications of the guidelines given by the DCI. So let's talk to Dr. Niketh and find out more about safe dentistry in today's COVID times. Dr. Niketh, thank you so much for joining me yet again on To Talk with Your Dentist conversation, and a warm welcome to you.
Thank you, Dr. Rekha, for saying so good words, and it's my privilege to be here. And one thing, yes, your Friday, those small memos which always come on my WhatsApp and on the patient WhatsApp, they are always being liked by my patients. So thank you for providing such type of services to the dental community and the patients also. Thank you.
Thank you. Thank you so much. I think like as you are aware, since you deal with communication and helping dentists communicate, how communication plays a key role in dentist-patient interaction. So since that is lacking in many times, so I just thought maybe doing something like this to communicate with the patients would be helpful, and I'm glad it's helping.
Yeah, it's helping everyone, not only patients, we also, right?
Oh,
Thank you.
thank you so much. Thank you so much. So, that really motivates me. So, Dr. Niketh, how has it been after now that the official lockdown is off and we are again getting back to the normal? How does it feel? What is your experience in terms of how the pandemic is panning out?
Oh, same thing here. Everywhere it is almost same. Means none of the area is untouched. Patient number of patients are increasing. Cases are increasing because testings have been increased, and this will happen. But again, the things will not stop. And like everywhere, businesses are smartly opening up, and then we are actually learning a new way to live. So I think we have to be with this.
I gather. I gather so because I think this virus is here to stay. So we just have to probably work around this particular, threat aspects like that, and devise our own ways to just keep moving forward in life.
See, I know that this is tough for everyone. This is tough time for everyone actually, and moreover, this is a situation where every person is searching a new way to restart his life. So
Yes.
this is going to happen. Everything was stopped for at least for last, I think, almost 3 months,
Yes.
and now when things are still not safe, but we can say that if it is not safe, then again it is not normal. So we all are trying some new ways to restart our life, maybe from a street vendor to a big mall owner, or maybe from an employed to a self-employed, or maybe from some private agencies to government agencies, even big hospitals to the small clinics. Everyone is in search of finding this safer new.
Yes.
So this is going to happen.
So do you think, Dr. Niketh, in a way, patients are still a little apprehensive about visiting hospitals or clinics? So do you think there's a difference between visiting a hospital and visiting a dental clinic?
Uh, Before we think about the visiting a hospital or a dental clinic, let's take this thing to general public, like in the sense to the general shopping area or any general place. Uh, See, nothing is actually changing. We will do all those things again. We might walk freely in the park freely. We can go for a dinner freely later on. We will do everything what we were doing before. But there is one thing which is going to be changed, and that thing is that we need to accept few new norms.
Yes.
So if there is a challenge in moving to a hospital, or if there is a challenge in moving to a dental clinic, before that, as a layman, already have few challenges. Like, your first challenge is to keep your family and loved ones safe. That is
Yes.
the first challenge we people have. Gradually business are opening, which is right, because one can't stay away from the business for a long time. He
Yes.
or she needs something for his living
Yes.
now. But all of us know that COVID cases are rising, and this is the first hindrance to our first challenge, to keep our families safe, to keep our loved ones safe. So we need to go to those business places. There is no other option. We will go there, but we have to go smartly. We
Yes.
need to follow all the social distancing norms. We need to have use a good face mask, maybe a eye cover. Maybe we need to disinfect our hands frequently with soap. We need to do all those things. See, uh, whatever I'm telling you, these all things we already know, that we need to know about the social distancing norms and all other things. The time has come where we don't need to teach what actually you need to do,
Yes.
but we need to know that this is a time to learn that we need to do all those things dedicatedly.
Yes.
So this is like a problem for us. Now, as I talked, that your first challenge is to keep your family and loved ones safe. Maybe a social life is a big hindrance in countries like especially India. See, in our country, social life is very important.
Yes.
Celebrating family moments, festivals, Indian weddings,
Yes.
dinners, birthday parties, everything is very common in every Indian household. Move from north to south or west to east, everywhere it is there. But now this is a challenge for us, because I would say that I might not be able to attend any such event for next 3 months, 4 months, 6 months, 1 year. I
Yes.
don't know. Right. So
Yes.
this is a challenge for me. Traveling. Now you can also think about the traveling, is because we used to travel a lot, maybe for a business or the personal issues. Now that has become a challenge. Shopping has become a challenge. Similarly, the health management is become a challenge for us. uh, Now this health management is important aspect for the COVID, after COVID, because everybody knows that now fitness is very important. You need to
Important.
improve your immunity. You need to remove few bad habits. But again, these are all challenge in specifically in this time, at this time, particular time. This is a difficult time for us, and yes, it is difficult for us to go to a hospital or a dental clinic. But again, to move to any other social place, it is a difficulty.
Yes. Yes. So, what do you think as a dental practice? Do patients actually need to have any apprehensions, or from our end, do you think dentists are equipped enough to face these challenges?
See, dental practices are also not untouched, very frankly, right? Recently, many things were said and explained that worldwide about the dentistry, that
Yes.
dentistry was standstill, and all the practices, all the dental practices almost worldwide, they were in
Worldwide.
all in the mode of waiting.
Yes.
So they were waiting and they was just watching. But life has to move on, and so the dentistry. Now people are asking whether it is safe to get that dental treatment or not.
Yes.
Should we go to our dentist or not?
Yes. Yes.
Or is it going to be unsafe forever? So the question is that, is it going to be unsafe forever? So there are many questions, and I would be answering few. First, you need to understand that who are dentists and what they do.
Yes.
Earlier, people used to think that dentistry is just taking that tooth out and giving you a replacement,
Mm.
right? So that was more like an elective branch.
Yes.
But gradually, with new advances, dentistry has grown bigger, bigger
Yes.
than many of its counterparts.
Yes.
It has taken a long course of from being an elective branch to a reliant branch. It has taken
Yes.
a lot of time in that. Now you
Yes.
can't think your life without dentistry or without a dentist,
Yes.
right? One good thing has happened in this branch is understanding the role of sterilization
Yes.
or asepsis, or in the simpler words, clean environment to work.
Yes.
right?
Yes.
Now, since dentists, they work in oral cavity, and
Yes.
chances of transmission of infection is always higher. Not
Yes.
in COVID time, it was
Yes.
before also.
Even before. Yes.
Either it would be from a patient to operator, or it could be from operator to patient. It could be
Yes.
from patient to your assistant,
Yes.
or from your assistant to your patient, maybe from assistant to operator or operator to assistant. Means anything could have happened.
Yes.
And these things were clearly being understood by dental faculty way before COVID,
Yes.
right?
Exactly.
Now, I am already been in practice for almost 20 years now, and I always consider my working areas, my operatory as an operation theater.
Yes.
Now, so
We are
we
more or less
all are
taught like
putting
that.
up those.
No,
Yes,
we
we
were
all
all
were doing
taught.
that, and
We were all taught even in school, in dental schools. We were also
yes,
always taught
yes,
that sterilization is of utmost importance. I remember
that was
our
the
teachers.
first lesson we all.
I know our teachers
Yes,
would never let us
yes.
touch the patient if we didn't get our kids sterilized to the operatory. They
That's,
would not let us into
that
clinical at all.
absolutely, that was the first lesson we
Yes.
learned in dental colleges, right?
Yes.
So this was way before 20, 25 years ago. Now the things have changed. So we all were taking those measures before. Yes, I can agree that many of us were missing few things here and there. I don't deny
Yes.
that. But
Yes.
in COVID time, all of us realized that we need to follow norms very strictly.
Yes.
Now, at various dental platforms, we all are discussing that what is necessary, what is not necessary. There is a lot of debate is being happening everywhere. But one thing is sure that everyone is working to make things cleaner than before,
Yes.
right? Government agencies, they are working in providing guidance to the doctors. Senior practitioners, they are helping in implementing those ideas.
Yes.
Dental dealers, they are helping actually to make those things available to the dentist, and
Yes.
every dental practitioner is trying to follow the guidelines depending upon his practice. So this is happening, right?
Yes.
Now, I would not mind to say that in every profession there are some people who don't believe in the change, right? And yes, this is law of nature, that if you don't want to change with the change, you will stay where you are and things will move further away. So I'm not talking about those practices, but I'm talking about maximum of the practices who are changing with time. So I
By
can
and
think that
large. By
maximum
and
practices are changing.
yes.
Yes, I think it is more than 90% that are ready to change. Now,
Yes.
whether it is safe or not, the question is always like whether it is safe to go to a dentist or not. I believe nothing in this world is 100% safe.
Yes.
Like moving on road is not 100% safe, as anyone can come and hit you. Believe me, eating food is not 100% safe. If you eat in improper
Somewhere.
manner, it can block your airway, right?
Yeah.
Going to playground is not 100% safe because any injury can be fatal, right?
Correct.
So traveling by plane or train is not 100% safe because
Correct.
accidents can happen. So my take is like, would you like to stop these activities?
You can't.
No, you
Yes.
can't, because you need all those things. So rather
Yes.
you will be cautious,
Yes.
right? You will be
Very
cautious, but
cautious.
you will not stop. So
Yes.
similarly in dental practices, your dentist has become cautious.
Yes.
He is getting ready for your safer dentistry. Few clinics are almost ready, few are just waiting for things to reach there. So
Yes.
those who are waiting, they are waiting for new protocols, new equipments, that those things should be available to them so that they
Yes.
can provide safer dentistry to their patients, right? You just need to do one thing. You need to trust your dentist and let him tell you that this is the right time for this particular treatment or the procedure.
Proceed.
If he is
Yes.
denying any procedure, then you should understand that he is doing it for your sake, not for his sake. Maybe for his
Yes.
sake also, but for your sake
Correct.
also,
Correct.
right? So for
Correct.
me, I'm not worried about any unsafe dentistry, because for me this unsafe dentistry is hypothesis. I'm very happy that dentistry and dentists are actually creating a safer dental world. So for me, I would say that there is no big challenge for the patients, and dentists are really working very hard in the background to provide you a safer dentistry.
Yes, yes, that is very true. That's very true. Like what you said, Dr. Niketh. I think dentists have always been taking, strict sterilization protocols in terms of autoclaving the instruments or sterilizing the area, the operatories and things like that. But like you said, I think now because there is a situation here, some added protocols have to be added to the existing ones. And I think the way I have seen, most of the patients are very intelligent. They themselves understand that in a particular situation they should not visit, a dentist, or when they can visit a dentist. So I think a good understanding and a good communication between the dentist and the patient helps in providing safe dental practice both to the patient and to the dentist.
Absolutely. 9 out of 10 patients, they understand this thing. Nine
Yes.
out of 10 dentists, they understand this thing. So we just can't discuss about those one people which are everywhere, right?
Correct.
So
Correct.
basically, everyone is understanding this, that whatever other person is doing is for their benefit. So this is quite normal.
So that means to say in today's date and time, as of today, like we are almost at the end of June. So which means to say from this time onwards, it is safe for people, for themselves, or to take their children or their family to visit a dentist if they have an issue. There should not be a problem as such like that.
There is no such problem that you can't visit your dentist, or there is some problem is there. No, that is not a problem. You can very easily go to your dentist. Yes, but you should not insist your dentist to do what you want. Now you
Correct.
have to just trust your dentist. Whatever he says, you
Yes.
should believe that and follow that. Because if
Correct.
he is ready, he will do. And if
Correct.
he thinks that this procedure needs something with which he is not ready, so he
Yes.
might deny this. So you have
Yes.
to understand this thing, that few processes we are not doing, few things we are doing. So this is depending upon the demography. This is depending
Yes.
upon the availability of materials. So this thing will happen for a few more months, but
Correct.
it's absolutely safe to visit a dentist. That is not a problem.
That's not a problem. Okay, okay. So, Dr. Niketh, that was very informative and very nice. And of course, I think it's a very positive approach right now, and also it gives a lot more confidence to our patients that it is absolutely safe to visit a dentist. And small little procedures are not a big hindrance. It can be done with the right protocols. But like you said again, some procedures with the dentist himself feels need to wait for some time. Probably the patients have to understand, and I think they're willing to wait. I think there should not be an issue with that.
Absolutely, absolutely.
Okay.
There is no problem
Okay.
with that.
Yeah. So hopefully, we'll have safe dental practices during COVID and even post-COVID. Considering everybody has upped their protocols further, I think it's a lot more better and better quality dental practice that will come henceforth. So, yeah, I think Dr. Niketh has some technical issues. So I guess
Yes, please.
yeah.
Yes, please. I'm back.
Yes, yes, yes. So, Dr. Niketh, I just wanted to thank you so
Yes.
much for joining me today in today's conversation and sharing your experiences and your opinions on current safe dental practices in India.
Thanks a lot, Dr.
Thank you.
Rekha, for inviting me second time here. And
Thank you.
ever I meet, then you're most welcome to call me again. Thank you.
Anytime, anytime. I would love to have you back again to share all your experiences with our patients again, Dr. Niketh. Thank you so much.
Thanks a lot. Thanks a lot.
Viewers, that was Dr. Niketh who did share his experience with us about safe dentistry in today's times. If any of you have any dental issues and if you are apprehensive about it, I hope this talk with Dr. Niketh helps you understand that dentistry is safe in today's time and you can visit your dentist for your routine checkups and follow his advice on your oral health procedures. I hope that talk was helpful. In case you have any doubts or queries, please don't hesitate to write to us in the comment section below and we will get back to you on that. And for more information about your oral and dental health, log on to our website www.thedental.com. Do subscribe to our YouTube channel to get your latest updates on oral and dental health. And you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. So until next time that I come back with another dentist with another topic about your oral and dental health, stay safe, be happy, and keep smiling. Thank you.